Well, welcome to the latest webinar on climate change series. Today we are discussing climate change and health impacts. And I think the most visible, information that we could gather around climate change and its impact is just looking back at 2023. In 2023, we've seen world records. I think it was the world record year when it comes to climate change. Heat waves going through across the globe, basically. Canada, of course, had quite some big wildfires as a response to that. And then highest temperatures observed ever, 49.5 degrees, which is about 4.6 degrees higher than the highest point we've seen before. That speaks for itself. If you're looking at Europe, and there was just a paper in Nature coming out just shortly in May as well, saying that we had, in the last 2,000 years, we have seen the hottest year ever in 2023. And that with a 90.5 confidence interval, which is great, right? So this is really looking back at last 2,000 years, extrapolating what has happened. Evidence is building up strongly. But heat waves is not everything here when it comes to climate change. Heat waves comes also with droughts. It comes along with floods, with storms, wildfires. We talked a bit about that already. Rising sea levels, melting glaciers, of course, and shifting ecosystems. And these all have implications for human health, for nature as well, for well-being. And it's important that we explore this topic here today with our two guest speakers that we have invited. So Swiss Re as well has published a paper just last year, looking exactly into that, climate change and life and health outcomes. And we've been looking at actually what are the biggest drivers for health impact. Health, looking at mortality specifically here, heat, infectious diseases and air pollution are the biggest amongst the drivers that we just looked at. And they are probably the most contributing to mortality outcomes, morbidity outcomes, as we have explored that. We've been also looking into mitigating actions, particularly for an insured population that is a wealthy population that has means to protect themselves, buying air conditioning, for example, or being in shelters when the storms hit. So we came then to conclusion as well that the impact on climate change and on the different scenarios over 2050 and 2100 can be for an insured population small, but depending on the degree of change that we are seeing, can also be significant. So it really depends out where the journey is going to take us. It's important that we understand what it is and how we can protect ourselves. And I think these mitigating actions is really something we should be focusing here on in this discussion as well with our experts. So let's turn to our two guest speakers. And I would like to quickly introduce my speakers here. Joining virtually, we have from London Professor Ian Hamilton. He's the former Executive Director of the Lancet Countdown on Health and Climate Change, and a professor in energy, environment and health at the University College of London. I think the latest publication that just came out was from Lancet Countdown on Europe, the European piece that came out, and we're going to hear hopefully also a bit of the messaging that you have put together in this paper, which was quite exciting to see. And then as a second speaker here in the studio, welcome here, Adrita. So who is the Program Director of Health and Demographic at the Geneva Association. So a great pleasure to have you here on board with me.
Thank you.
In this office. So let's get started with you, Ian, from the scientific frontier. Lancet just published, as we said before, this paper, but what is going on? What is the evidence? Yeah. And where are we on the track of climate change and the impact to health?
Yeah, thanks, Christoph. And you highlighted exactly this issue already. We're already experiencing a 1.14 degree of global heating. What does that mean? It means it's the hottest global temperatures we've experienced in the last 100,000 years. And this has broken heat records all across all continents in 2022. The result, as you have highlighted, is that actually health systems are under strain. So the ability for us to be able to protect human health through health systems, through ensuring that the environments that we're living in are capable of offering a healthy environment is really being fast diminished. And the implications for that on health are important because it's a growing warning sign of what's to come as well. We are not anywhere near the level of mitigation actions that are going to be needed to address CO2 emissions. But we face adaptation risks in the future, but we're experiencing those health impacts right now. So we need to ensure that the actions that we're taking are going to have two issues, in mind at all times. One is to ensure that we're going to be reducing the risk of climate change increasing over time as much as possible and addressing the built-in we've already got. But in doing so, it's going to be protecting human health in an equitable fashion as well, because as the report you mentioned highlights, and we're seeing this particularly in Europe and other emerging economies, differences in those who have access to health services and those who don't. And so being able to say, look, at this point in time, we're moving in the wrong direction around emissions, but there are things that we can be doing to address these types of effects. So I wanted to pick up on a few that you mentioned around, say, heat, for example. One of the issues that we've seen in heat, and this is true in Europe, is that summertime temperature, that global mean has increased by 3 times in 2022 compared to a period of 1980s to 2000. So 3 times higher than the global mean. What we're seeing then is that the maladaptation, take Europe as an example, North America, where a lot of the buildings and the cities are designed for a cooler climate. This is going to mean that a lot of people are going to be exposed to those higher temperatures in their homes and in the cities that they live and work around and walk around in. At the same time, we want to be encouraging healthier lifestyles by saying, get out, walk, be active in the green spaces and urban environments, but they may be being affected by temperature in ways that we really hadn't anticipated, merely a half a century ago. What we're also then seeing is that those whom are more particularly vulnerable to those types of heat exposures, so infants and people over the age of 65, it's increased quite a lot. So the number of heat wave days has increased more than 100% since even the early 2000s. So the frequency, and this is something which we wanted to pick up on, is this idea of the intensity and the variability. So climate change is just not a gentle process upwards and warmer. It's actually about loading in a lot more variability season to season or week to week in terms of how we're seeing precipitation, how we're seeing heat manifest. And the implications that mean is that for human health is that we're finding is that those acute events are going to precipitate a lot, but also that baseline continues to increase. So those baseline issues be like wildfires, as we've mentioned, the risk around smoke and inhalation particles kind of increases across lots of countries where, again, rainfall patterns have been changing. That, of course, has effects for drought. But when we think about the actions around mitigation, you mentioned air pollution as well in the report. And this is an important area for us to consider the sources of air pollution. And one of the things that we track in the countdown is looking at where, from what industrial sources, transport sources, buildings, power, et cetera, these are coming from. And particularly in emerging economies where rates of industrialization might be low, we're seeing that the relative effect is not as impactful as, say, it is currently in Europe, where you've got a lot of transport-related emissions and industrial emissions. So taking action to mitigate those, to fuel switch to cleaner sources of fuels, will actually have not only a direct effect on CO2 emissions, it's going to fairly immediately reduce our exposure to those particles. That's going to be beneficial, particularly for those, again, vulnerable to air pollution, especially during heat wave events when those two things merge together and the demands on health services can be, quite precarious at that moment. So, I mean, those are some of the issues I want to raise. I know that, Adrita, you've got others, but I think the actions that we can take now in terms of mitigation, in terms of being able to adapt our cities, our building stocks to be more capable of withstanding heat exposures, we're going to have and we're going to see immediate effects now in terms of what does that mean for human health. So we've got risks that we're facing, but we've got a lot of actions that we can take to create near-term benefits.
Yeah. Thanks a lot for that, Ian. I think when I'm listening to you, we don't only have to deal with actually cold, right? So what we have been focusing on is actually insulating, right? And making sure that we don't have to heat as much just to reduce our carbon footprints. But now you're telling us a different story. You also need to look after the heat waves that are coming and make sure we can actually cool down systems again. So what are the implications that you see when you're just looking at this footprint on housings, right, on both sides? More insulation, but then because the more insulation you have, you actually contain the airflow as well and so on. So that also have effects.
That's right. So it's incredibly important. And I don't want anybody to get the wrong impression. Right now, a lot of Europe's emissions, for example, in North America, are going to be dominated by that type of activity, heating our homes in the wintertime. I live in the UK where we have one of the most aged building stocks and least efficient. We have a lot of work to do to ensure that we're cutting those emissions through, yes, insulating, better glazing, but then also considering that system, like switching from a boiler to a heat pump, will offer an ability to heat our homes, is electrically driven, so as the grid decarbonizes, that's a great opportunity. But what it can also do, in theory, is provide protective nature for cooling if needed. And at the moment, there are more simple solutions, making sure that we have good windows and shades. And a lot of countries, it was an ability to kind of just small designs can help to reduce a lot of the heat exposure we might be getting indoors. Making sure that one of the things that we'll see as a counter effect around reducing air pollution in cities by fuel standards and fuel switching, for example, is going to mean people are more willing to open their windows, where right now you might get a lot of dust coming in or a lot of air pollution sitting on your tables or your windowsills. That will change. And so I think we'll see some synergistic behaviors emerging when we have one thing, meaning we can open windows and get clean air, versus right now where it's not the case. So we want to make sure that we're prepared for both instances. And again, the built environment can be adaptive. We just have to make choices that we understand are going to be beneficial both for cold and for heat.
Excellent. Thanks a lot. So let's turn to you and Adrita. So you've just published also a paper, right, for the life and health insurance industry on climate change and impact. So what are your findings?
Well, thank you very much for having me here, Christoph. Just to give you a very high-level overview of what we found in the paper, and also to an extent mirror what Ian was just saying, we wanted to actually take a very comprehensive 360-degree view of what happens to health. And that meant that we were not just looking at extreme events, we were also looking at chronic events, because mortality risk is tough, it's hard to quantify, but it's still easier from extreme events. It's harder to understand what it's doing in terms of triggering morbidity or reshaping existing disease burdens and how that influences longevity outcomes, which life and health insurers are particularly concerned about, and as well as cost of care. So we also looked at extreme heat, but we also looked at what happens, the aftermath of it. So we looked at water scarcity, drought, which has got association with kidney diseases. We looked at prolonged exposure to extreme heat, which has got association with cardiovascular diseases, allergies, asthma, including antimicrobial resistance. And so based on what we found, we categorize the risks, the potential risks that can come from climate change to health are four. One is the acute risk that we talk about from extreme events that leads to fatality and injuries. The other one is a chronic risk from prolonged exposure. So things like respiratory illness and the chronicity of illnesses that you see. The other one is a transition risk, which is mixed really, because clean air can be very good for our lungs, but if there have been evidence also balancing this with fracking sites, because there's evidence to show that infant weight in people, children being born close to fracking sites have a unusually low weight. And we also looked at litigation risks. That wasn't the main focus of the report, but nonetheless it is also becoming a hot topic in terms of the current threat and the future threat to health that comes from climate change, and what kind of risk and how you think about those risks. And these risks are then calibrated upwards and downwards based on the health system that countries have, and before they spill over to insurance. And the evidence is in the paper, and when we looked at the health system's capacity, and including papers that have come out since our report has been published, it doesn't look great. It doesn't look very promising in terms of how health systems are able to cope with some of this as well. And Ian already mentioned, they're already stretched. Post-COVID, we are still doing a lot of catch-up. And so moving on from the population level data to really talk about insurance, I think the headline message now is that right now, health and life insurance liabilities have not been affected by climate change. But that is not to say that it won't be, or that cannot also be said with a lot of certainty. It could be for two reasons. One is the insured population characteristics from the general population characteristics are quite different. They are younger, healthier, they may have more white-collar workers than blue-collar workers, and really this is something that is also interesting from the general insurance side, is that here the risks really depend on socioeconomic conditions more than geographic geographical location. So something to bear in mind. And the other thing is we don't have climate-sensitive data when we look at claims. We might get a claim saying stroke. We may not get a claim saying stroke, but potentially as a result of a prolonged exposure to very high temperatures. So that could be, maybe the risk has sneaked in already in our data, but we have no way of disaggregating it. So those are the current challenges, and we mapped those findings around an insurability framework to understand what will happen to insurability in the future. There are quite a number of challenges. We talk about units of risk exposure, and they need to be independent. In this case, it's not, and also the interconnectedness that is there, it's also very non-linear. So not everybody exposed to extreme heat or everybody exposed to very poor air quality will end up developing respiratory illnesses or have a stroke. It depends on many, many factors. But at the same time, we know there's an imperfect relationship, but we have no tool right now to decode that. And it's further made further difficult task because of the incompleteness of data. There are also market considerations. At the moment, we don't know what will be acceptable to the population in terms of climate change and health products, integrated in health products, at what costs. Though we do see some promising innovation around parametric features in insurance that goes some way to actually mitigate the poor health outcomes of climate change. And we also see preventative services coming in and building in, and they have an overlap between climate-friendly behaviors and health-friendly behaviors. But I think the point I'm going to finish with is it's also, we talked about the data issues. We have a societal consideration here. Even imagine, at the moment, we cannot underwrite in a traditional way health risks posed by climate change because we don't have the data. But even if we have the perfect data scenario, what will we do with it? Can we really exclude somebody who lives in a very, very hot area and doesn't have air conditioning? One could even argue, is air conditioning even a sustainable way of thinking about these risks? Or, even if they have an air conditioner, do they have the means to actually keep it on by the time when they need it? So all of those comparisons, the ethical dilemma of this really comes in, where when it comes to, balancing actuarial soundness with inclusivity goals of insurers.
Thanks a lot for the mortality. So you're really looking at mortality trend risk, right? So that's slowly creeping into the insured population. What are the biggest risk factors you see? I mean, you mentioned air pollution, AMR, we have vector-borne diseases, we have heat stress. What do you think is the most
I think it's, I wish I had a crystal ball, Christoph, but it's hard to pin that down. But I would say it would be pretty implausible to think, given the intensity of events, that insured population are not going to be affected. I think vector-borne diseases, chiming with some of your own findings last year, is definitely a risk. I mean, they don't discern between insured population and uninsured population. We certainly see mortality risk, particularly a concern for elderly population. As we have seen in the data, if you look at the disaggregated data that has come from Europe alone, we actually see elderly population disproportionately affected in terms of mortality. And I think long-term trends is, I think, look at the two biggest insurance markets. Let's say the country I come from, England. We already have 15 million people suffering from chronic illnesses. They eat up 70% of the health budget. They make up 70% of bed days, inpatient bed days. In US, it's 50% of the population gobbling up about 90% of the healthcare budget. So the long-term prospect, I think we really need to find a way of decoding this for the burden of disease. What does it do? How does it multiply? Does it multiply? Does it trigger more, or exacerbate the intensity of healthcare episodes? So those are some of the considerations. But there was, lack of data has also meant it's very hard to put a population picture on the insured population.
Yeah. Ian, you've been also analyzing the vector-borne diseases, leishmaniasis, for example, or dengue fever, as we have seen the latest outbreak in Brazil with over 1 million of people affected. How how well are we prepared to deal with vector-borne diseases in Europe?
Yeah, it's a great question, and this is something where both speaking to the increase of malaria risk as a vector pool in Europe, because as we see a changing environment around, it's getting warmer in places that suitable standing water for Gyptes Aedes to make that transmission risk increase. We're also then seeing, particularly in Mediterranean areas and where the warm waters, where we like to go swimming for holidays, increase the risk of Vibrio, which is one of those terrifying sorts of infections that can really cause a lot of damage to someone. What we're really getting at is this intersection between a pool of diseases, vectors of transmission, intersecting with communities that have not had exposure to those in the past. And as you point out, what's the detection process around which? Now, Europe, of course, it has a lot of ability to detect disease and share that information. Right now, for example, in the west of the UK, there is a current transmission outbreak of a bacterial in water, which is causing concern. These types of detection and transmission around information does happen. The risk is where they're not yet suitable, widespread detecting mechanisms to ensure that, for the general population to understand the risk. And I think that's actually the more pressing issue is, do the general population understand the risk that they may be facing now and in the future, so that their practice, their behavior changes accordingly. So that way we understand actually to consider closing beaches down when there's a high risk of Vibrio, because we just don't want to take that risk for anybody. So I think as things change, our processes of communicating around that risk and what does that mean in terms of how we as individuals and we as governments and communities are revising that, particularly around heat wave plans. I mean, this is something that we see in lots of parts of Europe where they're starting to be much more observant of heat risks. And we undertook a review just recently looking at legislation and regulations across Europe to ask how many have suitable workplace heat guidance. And very few have thresholds around which work changes need to change. So, for example, if it reaches a certain threshold temperature for outdoor workers, that they need to be able to have more breaks, access to cooling equipment, water, etc. And if that's not present, we need to be able to introduce that now. And so the European Environment Agency, in response to the European Commission request, is doing that, is looking at the evidence, being able to provide advice so that our governments and our health systems are more capable of communicating that. So I think as these things change, our practices will change. We're fortunate in Europe to have resources to be able to do so, but I think it's incredibly important for us to not only consider how we change, but we need to be able to support communities, especially in developing economies, to be able to avoid these types of risks and plan for them in advance. The policy angle around this is very important because, as we know, diseases are not just local, they can, of course, be global.
Yeah. I like your policy angle there. I think the only one which makes it even worse is the working from home practice that we observe now, right? How can we enforce or enable our employees to have protective systems in their home environment, right? I don't think you can legislate that as easily. But let's move to the questions. We have a couple of really great questions coming through, and let's listen to the audience here. So maybe the first question is, if temperatures are associated with mortality, should we see that geographically now versus a reference to climate change when we look at populations in Arizona versus Maine? Ian, would you like to take that question?
Just to quickly respond on that, when we talk about that increase in exposed population, there's a couple of things happening. Take the example in the US, is that you have this diaspora effectively coming from the northern states down to the southern holiday states, and particularly those who have retired. So you have this exacerbation of both a vulnerable population in terms of elderly alongside an elevated temperature increase risk. And as you pointed out before, if the infrastructure is not capable of withstanding heat wave, for example, we saw this with a cold snap in Texas several years ago where the entire grid went down. There's a lot of damage done. The inverse is true for heat waves as well. All of a sudden, a lot of people could be put at high risk of exposure to extreme heats because of those types of instances. So what we do see all across the world, however, is a migratory pattern, which is populations are moving to urban areas. Urban areas have a higher risk of heat because of urban heat islands. They tend to also be moving into areas which are more just simply is where temperatures are changing alongside, so they're not moving to northern hemisphere areas as much, and moving into central equatorial regions. And that temperature exposure is tracking both the population change as well as the location.
Yeah. So infrastructure as a key element here as well. That's an infrastructure risk if we have blackouts in these larger cities. So it's an accumulation of risk actually coming together here. So it could be even worsening the outcomes. But here's a good question for you, Adrita. So are there any current thoughts on how to potentially parse out climate change from existing claims data?
Absolutely. So I think some good work is underway, but in pockets. I think it is possible to map claims data against climate data and get a really good idea about health trends, what's happening. What is more difficult is to directly, attribute those risks to any kind of claims data, because we don't say respiratory illness due to prolonged exposure to water, air pollution and stuff like that. The one thing I want to point out on that is that those kind of mapping exercises that are ongoing are really good way of getting the signal. But I think for insurers to make that information a bit more useful, I think we need much more granularity of data. Exactly what you were talking about, accumulation of risk. So you're not just looking at heat wave. You're looking at the number of elderly population. You're looking at power grids. You're looking at evacuation or building protocols. I mean, hospital evacuation protocols. They all need to come together to really understand what is the risk that the insured population, you can argue any population, but in this case we're talking about insurance, so insured population face, and then what are the mitigation strategies?
Excellent. So let's have a look at the next question. Are there any potential vector-borne diseases of concern? Ian, you're the specialist here.
Yeah. Well, a specialist in at least channeling the evidence that we've tracked over the countdown. And the short answer is, look, yes, there are. And partly this, as we said, is to do with the change in the capacity of different environments to carry this. So we're looking at arboroviruses, for example, when we have data on rainfall and temperature. So this means things like Zika and chikungunya, their ability to transmit in environments that have not yet had these. So we are seeing cases come to areas that had previously or historically not. Mentioned malaria already, the malaria transmission risks, being able to transmit into parts of Europe that had historically not seen that. I mentioned Vibrio already in terms of warm waters in Mediterranean and other regions. West Nile virus is another good example, and this tends to hit the northern parts of the hemisphere as well, where temperate wood environments kind of have an increase in mosquitoes able to transmit that, but their relationship to other animal species as well increases that risk and encroachment. So we see this with ticks and Lyme-borne disease coming from change in population of deer, for example, across North America. And those are then all of a sudden assuming, for example, this was about the detection of systems as well. Now for most regions of North America, they're treating any tick bite as a risk of Lyme disease, and so they treat accordingly. Whereas historically, that was not at all the case. So again, the medical practitioners are just understanding that risk has changed and where it's coming from. So I don't want to paint a terrifying picture, but it's one where we just have to understand where these risks are coming from and start planning accordingly.
Yeah. And I guess some of the activities that may mitigate is information, right? Making sure that people understand.
Yes.
Also our medical practice, they need to be educated on these new diseases that they may have never seen actually in their practice. So these are new risks.
Just ICD codes having some sort of climate sensitive information in it, as you bill. So yes, absolutely.
Would be another one to look at. Or vaccines. Vaccines we've seen in malaria and dengue fever, some vaccines with some efficiency but not full protection. But nevertheless, there is movement also in that area, which protects us again over the long term, but there's a baseline risk that we carry. With that, we come to the end of this seminar and this discussion. I would like to thank you all for participating and for coming to this webinar. Thank you all.